We turn now to Rwanda, which has an impressive record in its fight against HIV and AIDS. Columbia University's Josh Ruxin directs several healthcare programs in Rwanda and says he went to live and work there because he felt it was a country where he could have a positive impact.
Rwanda has really turned out to be one of the success stories in fighting the pandemic of AIDS. The prevalence figures that have come out show that about 3 to 5% of the adult population is infected with HIV, and the government, through its programs, has done a superb job at getting much needed antiretroviral drugs to people who need it. So in Rwanda, this World AIDS Day is really a time to celebrate great successes. There's still tremendous challenges ahead, of course, because there are many people who still die for lack of access to antiretrovirals and many people who don't know their HIV status.
So are you saying that it's the treatment, it's the drugs that is making a difference in Rwanda?
Well, it's a combination. Just 4 or 5 years ago, there were only 2 or 3 health centers in the entire country where someone could go to get HIV tested. Today, there's over 100 such centers. So that makes a big difference. Just being able to know one's HIV status helps to stem the tide of the epidemic. Additionally, the government, with funding from the Global Fund to fight AIDS, tuberculosis, and malaria, and also PEPFAR, which is the U.S. government's AIDS initiative, has managed to roll out antiretroviral drugs to over 35,000 people who need them. And this is an enormous proportion of the people who are currently in need. I think one of the big stories that continues to be untold here is that there are 2.5 million new infections that are going to occur in the coming year. Most of those will be in sub-Saharan Africa. And I think sometimes people wonder, well, why so much focus on Africa? And the reason why is that the public health infrastructure is simply not in place in order to address this epidemic. And the good news about AIDS is that it has helped to create brand new monies which are being used to improve health centers across the continent. But much more is going to be needed if we're going to improve these health centers, not only to address the AIDS pandemic, but to address all these other diseases which are robbing families of mothers and fathers and of children. One of the health centers that the Millennium Villages Project is involved in Rwanda, in Mayanje, has done such a great job improving the quality of health that a woman in the community approached me just last month and she said, you know, I'm a little bit angry with you. I used to have a job in this community that I don't have anymore. And I said, well, what exactly is that job, Jacqueline? And she said, well, I used to coordinate the funerals here. And for the last 8 months, there hasn't been a single funeral. But just last year, I was coordinating 3 or 4 funerals every single week. But because we are currently providing antiretrovirals, providing HIV/AIDS testing, providing insecticide-treated bed nets, these deaths are no longer happening. And what I think that really demonstrates is how when the Rwandan people are provided with the funding and inputs that they need in order to fight off these diseases, they can accomplish great things in very short order.
Dr. Ruxin also says the AIDS epidemic is a symptom of poverty. When it comes to fighting it, improving agriculture, education and public health services around Africa are critical. Next on Inside Africa, one of our CNN team returns to Lesotho, where thousands of HIV-positive children would have faced certain death a couple of years ago. Now they have a shot at a normal life.